Hello guys, so good day, hello. I hope you are all doing well and let's discuss today your lipid profile test. So your lipid profile test are very important tests under your clinical chemistry. And class, kasama to sa exam natin. So class, lipid profile is very important. Yeah. So class, the number one killer, the number one cause of mortality around the world, worldwide. And not only here in the Philippines, but all over the world, class is COVID. Hindi. Class is our cardiovascular diseases. Cardiovascular diseases, guys, are still the main cause of morbidity. Yan. And class, what's very unfortunate is those who are at risk or already have cardiovascular disease, class, they are at high risk of morbidity from COVID. So kasi class yung mga gamot na ginagamit in the medication of COVID uh, complicates cardiovascular diseases. And so class lipid profile tests are very important in monitoring, preventing, treating class cardiovascular diseases. Yan. Napakalaga class ng lipid profile test. So if you want to check, diba? If you want to check, diba, since we're learning about this ones, kung gusto nyo magpa-test ng lipid profile, why not? Yan. Especially class if you know your family are very prone to hypertension. Yung isa kong estudyante recently, may fatty liver daw siya and pinapalipid profile test daw siya. So sabi ko, tatanong niya, ma'am, curable ba yun? Sabi ko, depends kung saan galing. And so, ayun, class. So, some people are more prone to cardiovascular diseases, fatty liver, at yun. Magandang test to assess the prognosis, and where are you at in your in the progress of disease. Yan, maganda gamitin class ang lipid profile test. So we're going to learn today your cholesterol, triglycerides, lipoproteins, the different determinants and methodologies on how to measure their quantity. Yan. Okay. So, ayan, marami nga namamatay ngayon. Hindi lang sa COVID class, hanggang ngayon, pati sa cardiovascular diseases. That's why our health system is actually overwhelmed. Kasi at normal days, ang rami nang may sakit. Pero dinagdagan mo pa ng isang pandemic class. Kaya ayun, just looking at India, that's the picture of how overwhelmed their health system are. So class, your lipid profile tests are best, yan, kung kayo talaga yung kinakausap ko, if you're my target audience, yan. If you want to prevent atherosclerosis, is the build-up of fats, of cholesterol in the walls of blood vessels. Class, pag may plaque formation, yun nga, plaque, yung accumulation of fats in the walls of the blood vessels, class, it becomes more fragile, mas madali siyang pumutok, which could result to stroke. Ayan. We have coronary heart diseases, so there could be blockage in the coronary artery, and class myocardial infarction or heart attack. Ayan. Class, all of this could be prevented. Class, if we could only monitor our lipid profile test, yan, our lipid profile levels. Yan. Pag sinabi natin lipid profile class, this is our group of tests that assess your lipids in the body. So class, yun, cholesterol has bad rap when it comes to yan, mga cardiovascular disease. But actually class, cholesterol is actually good because your cholesterol is for creating cell membrane, yung mga hormones natin, yung bile acids natin that break down fat, ang gawa sa cholesterol yan. However, class, excess cholesterol is not good. Yan. So, class, the transport and excretion of cholesterol is promoted by estrogen. Kaya nga tayo mga ladies, actually, we need that. Yan, because it gives a shape. Yan. And class, ang bad effect naman ng estrogen class, after menopausal, yun, many women tends to have hypertension, high blood sugar, high cholesterol because of estrogen levels, imbalance in estrogen levels. So what else? Essential for the diagnosis and management of lipoprotein disorders, lipoprotein disorders, cardiovascular disorders. Cholesterols are very important precursor of steroids. Progestin, glucocorticoids, steroids, mineralocorticoids. So mahalaga class to sa mga hormones, androgens, and estrogens. Yan, testosterone, class cortisol, and so on. The desirable level of cholesterol is around 200 milligrams per DL. Yeah. Anything more than that is borderline high, and greater than 240 milligram per DL is high cholesterol. Yan. So, di ba? Pwede kayo magpa-check na, or kunyari, encourage nyo yung mga parents nyo. Actually, dapat class, ang mga best. Ito, sabihin nyo sa mga parents nyo. Sana sa every birthday nila, kung wala man silang iniindang sakit, every birthday nila, sana magpa-test sila ng lipid profile, kidney function test, liver function test, yan. Para ano lang, yung preventive, yan. Apply nyo yung pinag-aaralan natin, yan. And total cholesterol is measured rather than its form. So notice that ang test natin is total cholesterol. Yan. Madalas yun yung test sa laboratory. So what are the chemical methods for assessing your cholesterol? So yun, ang principle daw is dehydration and oxidation. So we're adding this chemical, mga chemical developers. So acetic, sa Lieberman-Burchard reaction class, acetic anhydride plus your sample. Okay. Itong Salkowski is your concentrated sulfuric acid plus your sample, or with cholesterol. So this would produce costadiennyl monosulfonic acid, which is green, ang Lieberman. Ang positive reaction niya is green. Yan. So we could measure the colorimetrically. And Salkowski reaction, ang end product is cholestadiennyl disulfonic naman. It's a red end naman. Yeah. So, chemical Lieberman and Salkowski. So, for here, general methods of cholesterol determination, meron tayong one-step method, Pearson, Stern, and Mack, Mack-Gavac, and colorimetry lang. But if there's colorimetry and extraction, Lors, Abel and Kendall, ito yung madalas tinatanong sa part exam. Abel and Kendall, colorimetry, 3 method, extraction and saponification. Ito, Schenheimer, Sperry, Parak, and Jung. Yan, with precipitation naman, 4 step. Yan, madalas tinatanong ito, Abel, Kendall. So, pag nilagyan ng Abel, Kendall, it's cholesterol determination. So, here naman, it's enzymatic method. Yan. So, this is not a coupled enzyme reaction, but actually 3 enzymes ang ginagamit. Cholesterol esterase, yan. We have cholesterol oxidase and peroxidase. And the end product is quinone imine dye. Diba na-encounter na natin itong dye na to as end product? And it is measured at 500 nanometer. Yan. So, yan, cholesterol esterase yung una. So, i-liberate yung cholesterol ester. Kukunin mo lang yung cholesterol. Tapos, cholesterol plus cholesterol oxidase. Yan. So, we will liberate hydrogen peroxide. And the hydrogen peroxide plus phenol plus 4-amino antipyrine. Yan. Pag may hydrogen peroxide, ang enzyme niya na peroxidase will produce quinone imine dye at 500 nanometers. And the reference method for cholesterol class is ABLE, wag malilitaw, Levy and Brody method. Yan. So, your cholesterol, it uses hexane extraction after hydrolysis with alcoholic potassium hydroxide. So, yun, nireact muna sa potassium hydroxide, tapos in-extract using hexane. Then, upon the addition of acetic anhydride, isn't it, sa Lieberman-Burchard color reagent. So, color, green. Yan, CDC reference method. So, specimen consideration class. Pag lipid profile, fasting na lang. However, in my reference, cholesterol does not need fasting. Pero pag kasi isasama mo yung ibang test ng cholesterol like triglyceride, kailangan ng fasting. So class, 12 to 14 hours daw. So okay na yung 12 hours, 12 to 14 hours. Falsely increased daw pag may hemolysis, ecteric samples. Yan. Precise and accurate timing is valuable. Vitamin C and bilirubin are reducing agents that could interfere with your peroxidase. So pag may peroxidase, you have to, as much as possible, check if there are excess vitamin C, bilirubin. And the conversion factor to convert milligram to millimole, itong 0.026. Okay. So expect increased cholesterol, hyperlipoproteinemia, biliary cirrhosis, nephrotic syndrome, yun, may excess fat, poor controlled diabetes mellitus, poorly controlled, and decreased hepatocellular disease. Okay. Next class, triglyceride or neutral fat. So your triglyceride class is the storage form of lipids. So pag may mga adipose tissues ka, ang nasa loob nun class ay triglycerides. So your triglycerides, its chemical composition is it's made up of 3 fatty acids and 1 glycerol. So class, the breakdown of triglyceride is caused by your lipase, lipoprotein lipases, epinephrine, cortisol hormones rin. The fasting requirement is 12 to 14 hours. Itong talaga ang may fasting requirement. And class, it's also affected by posture by 50%. Yan. So kung nakahiga lang yung pasyente, let them be inclined lang. Yan. So desirable is 150 milligrams per DL, less than. Borderline is 150 to 199. High triglyceride na ang 200 to 499. Diba? Class, maganda magpa-check, and greater than 500. So, in cases of acute and recurrent pancreatitis. Yan. Conversion factor, 0.0113. So for chemical methods now, class, for colorimetric, we have Van Handel and Silversmith. So pag narinig Van Handel and Silversmith, dapat inisip nyo na triglycerides. Yeah. So here, class, so triglycerides in the action of alcoholic potassium hydroxide will break it down into glyceride and 3 fatty acids, glycerol and 3 fatty acids, diba? So the glycerol plus periodic acid will produce HCHO. And will react to chromotropic acid, which will produce blue color. Yan. Yan. So that's Van Handel and Silversmith. Baka may nakalimutan akong enzyme or something. Okay, so next is Hans method for fluorometric method. So, pareho. So, using KOH na liberate yung glycerol and fatty acid. So, fatty acid is reacted to periodic acid, forming HCHO. So, ito yung simplest aldehyde natin eh. Plus diacetyl acetone plus ammonia will result to diacetyllutein compound. Yan. So this is measured via fluorometry. Yan. And class, ito, glycerol kinases. Glycerol, ito. Yan. Disregard this. So ito yung glycerol kinase method. Yan, tama ito. So, triglyceride, so class, naalala nyo, ang nagle-liberate ng glycerol at fatty acid also is lipase. Yan. So, kukunin yung glycerol, you will add ATP, will, to the action of the enzyme glycerol kinase, will produce glycerol phosphate plus ADP. Dito sa method A, guys, ADP ang gagamitin sa third chemical reaction. Sa method B, instead of ADP, glycerol phosphate ang gagamitin sa third chemical reaction. So, nakakatuwa rin yung mga minds class ng mga nagde-develop nitong mga test na to. So, ito, ADP plus phosphoenol pyruvate to the action of pyruvate kinases will result to ATP plus pyruvate. So, class, itong mga enzyme na to, like kinases, lipases, actually matututunan natin to sa CC2. And notice, class, na every time may kinase, yan, kailangan itong kinases, kasi kailangan to ng kailangan may power to or may energy. So, notice, laging may ATP kasama. At sa opposite side ng ATP is ADP. Yan. So, yan. And the product is pyruvate plus NADH, and through the action of lactate dehydrogenase will produce lactate and NAD. So NAD ang minimeasure dito. So here, so instead of ADP, glycerol phosphate ang ginamit sa third reaction. Yan, plus NAD. So glycerol phosphate dehydrogenase will produce dihydroxyacetone phosphate plus NADH. Now this NADH will react to tetrazolium di, will to the action of diaquase, will produce formasan and NAD. Itong NAD na naman ang minimeasure dito. Yan. So dalawa ang variations ng glycerol kinases sa triglyceride class. Disregard this one. Yan. For D40, lipoproteins na tayo. Yan, madali lang to. Class, actually, there's so many different variations of lipoproteins. Pero doon lang tayo sa mga basic mo lang muna. So, class, ApoB. So, the lipoproteins which contains ApoB are your chylomicrons, VLDL, IDL, and LDL. Your non-ApoB containing is your HDL. So, class, your lipoproteins are very important in transporting your triglyceride and cholesterol. So, class, itong mga triglyceride and cholesterol, they do not travel alone, but they are complexed with this lipoprotein. Yan. So, may carrier sila, which is your lipoprotein. So notice, class, ayun nga, CM is chylomicron, VLDL is very low density lipoprotein, IDL is intermediate density lipoprotein, low density lipoprotein, and high density lipoprotein. So notice, class, they are differentiated by their density. Yan, density. So, may lowest na density is your chylomicron. Kahit VLDL ang pangalan, very low density lipoprotein. Mas least dense po ang chylomicron. So class, the substance that dictates their density is the presence of cholesterol. So class, pag mas marami silang dalang cholesterol or triglycerides, class, mas lumulutang sila. Yan. Kung mas konti yung dala nilang cholesterol at triglycerides, mas dense sila kasi mas more on protein yung nature nila eh. Yan, more protein yung nature nila. So, mas dense talaga ang high density lipoprotein. Ito. So, least dense ang CM, pero mas malaki siya. 500 nanometer. Class, actually, makikita mo ang chylomicrons. So, especially if you just extracted a person who just ate or bled sa blood banking, may nag-donate ng isang tao na kakain lang, makikita niyong lumulutang ang chylomicrons. Their blood looks chyluric. Yan, chyluric. So, ibig sabihin, increase ang chylomicron. It's chyluric. C-H-Y. Yan. Double check ko lang yung spelling. Chyluric. Chyluric. Yan. Chyluria. So, yan. Bakit sakit mo to? Yan. Yan. Chyluria. So, rich in chylomicrons. Yan. So, yan. Ang itsura nito parang milky yung blood. Yeah, and this could affect the clinical chemistry test. So, ayan. So, malaki siya. Malaki ang mga chylomicrons. At pinakamaliit rin ang HDL. So, class, not only they are differentiated by their density, they are differentiated by their electrophoretic mobility. From their migration from negative pole to the positive pole or to the anode. Yan. So class, chylomicron actually ang pinaka-mabagal kasi wala siyang charge. Ang pinaka-mabilis is HDL naman. Yan. Talagang mas mabilis siya papunta sa negative negative pole. Tingnan natin mamaya. Okay, simulan natin. So class, pag narinig nyo ang exogenous triglyceride, these are triglycerides that came from the diet. Pag nabasa nyo ang endogenous triglycerides, these are triglycerides coming from the liver. Okay, simulan natin. So for chylomicrons class, their principal function are to transport your exogenous triglycerides. So pagkakain, ang carrier na sumasalo ng mga triglycerides class are chylomicrons. Yan. And where do they go, ma'am? So they go to the liver and peripheral tissue. Yan. So not only that the chylomicrons take your triglycerides to the liver, but also to the peripheral tissue. Class, pag nabasa nyo yung peripheral tissue, pag dinadala sa peripheral tissue, pag dinadala ang taba sa blood vessels, it's a bad news. It's bad news. Pero ito naman chylomicron balance naman. It brings fat both to the liver and peripheral tissue. Pag dinala ang taba sa liver, it's good kasi mabe-breakdown doon, magagamit doon. Yan. Yun. So, it carries about 90% triglycerides. Marami siyang dalang triglycerides class, kaya it's very, it's the least dense. Least dense. Next class, your VLDL, it transport endogenous triglyceride. So class, bad news to. It transport endogenous triglyceride. So it gets triglyceride from the liver and bring it to your peripheral tissue. It has 65% of triglyceride. So class, ang VLDL, actually, it's also a bad cholesterol because it carries fat in your peripheral tissue, it carries fat to your blood vessels. Itong masama rin to. IDL, intermediate density lipoprotein. So this is a precursor in making your LDL. So ibig sabihin, pag mataas ang IDL, edi pwedeng tataas rin ang LDL kasi nga precursor siya yung mommy ng LDL. So pag hindi pa na mako-convert eventually itong IDL kasi into LDL. Next class. Your LDL is a cholesterol transporter. So it's the one that is richest with cholesterol and it's atherogenic. So it increases the risk of cardiovascular disease class. It's atherogenic. Yan. It increases the formation of plaque because it brings cholesterol to your peripheral tissues. It brings cholesterol to your blood vessels. Yan. So class, imagine niyo na jeep nyo to. Yung LDL, yung biyahe niya papuntang peripheral tissue, papuntang blood vessel. Dinadala niya ang mga taba sa blood vessel. Class, pag dinala ang taba sa blood vessel, it's bad news because it could result to cardiovascular disease, it could result to atherosclerosis, and so on. Yan. So class, it's the target of cholesterol lowering therapy. So ang mga pasyente class, ayun, pag nalaman na ay mataas ang LDL mo, mataas ang cholesterol mo. So ang goal natin, sabihin ng doktor, sige po, after 6 months, balik ulit kayo, i-monitor natin yung LDL mo. Tingnan natin kung gumagana yung binigay ko sa yung statin. Yan. So class, the reference method is beta quantification. So I talked with someone, I had the student, medyo matanda na siya, and sabi niya, ayun, he had high cholesterol, and one of the recommendations, one of the medications that doctors give are statins. So this statins class lower your cholesterol. But what's bad about statins, guys, is it not only lowers the bad cholesterol, it only also lowers the good cholesterol. Yun yung bad sa statin. And aside from that class, since binababa niya ang cholesterol, ay di naapektuhan na yung hormones, ganyan. So sabi niya, bumababa daw talaga yung libido ng mga lalaking nagtitake ng statin. So class, wag na, alagaan nyo na yung sarili nyo. Okay, take care of yourself. And you don't want to be drinking statin. It will decrease your libido. Okay, next class is your HDL. Yan. So, your HDL class is high density lipoprotein. So, ano siya? It's the least dense. So, ibig sabihin, pag mas hindi ka dense, mas you settle at the bottom. Yan. Mabigat tong HDL because it has least number of fat. It only of triglyceride. It only has 2 to 7%, and its protein level is mataas, 50% protein. Yan. So, yan. So, it's a reverse cholesterol transporter. So, from the tissues, yan, kinukuha niya yung mga taba from the tissues and brings it back to the liver. Good HDL. So, itong mga ito, reverse cholesterol transport. So, ito, yung mga taba, imbis na dalhin sa blood vessel, dinadala niya sa liver. Yan. Sabi niya, it's cardioprotective. So, kung mataas ang HDL mo, that's good news. And the reference method for testing this is ultracentrifugation. Yeah. And other tests are precipitation with heparin, manganese chloride, and Abel Kendall, the 3-step method. Reference method of actually lipoproteins are ultracentrifugation. Yan. So class, ito yung ultracentrifugation. So pag centrifuge ng sobrang bilis, so ang pinaka lumulutang, chylomicrons, next VLDL, next IDL, next LDL, last is HDL, FFA. Yan. Pakisearch ng class ko ng FFA. Yan. So sa electrophoresis naman, yan. So ito sa cathode, sa negative charge, ang pinakamabagal o hindi nagmamigrate class is chylomicrons. Yan. Tapos, VLDL ang next, LDL, tapos HDL ang pinakamabilis at ang pinakamalapit sa anode. Yan. So, yun ang electrophoresis rin. So, dapat HDL, tapos VLDL. VLDL daw dito. Baliktad naman sila. Pre-B. Yan. Check nga natin. Wait. Let's check sa Henry. Migrate electrophoretic mobility. Yeah. So class VLDL migrates to the pre-beta region. So ang problema kung saan ang pre-beta region. Pre-beta. Yan. So ito. So class chylomicrons muna. Tapos VLDL. Tapos LDL and HDL. Okay? Chylomicrons, VLDL. Sa ultracentrifugation, beta tapos pre. Beta tapos pre. Baliktad to. Yan. So class beta. So dapat HDL, VLDL, LDL, chylomicrons. Tama ito. Tama to. Dapat ko na lang nilagay. So class, ito yung negative charge, cathode. Ito yung positive charge. Tama to. So, HDL, ang pinakamalapit sa positively charged pole. Then, VLDL, then IDL, then LDL, and chylomicrons. Yan. Other test for measuring your lipoproteins, we have immunoassay or immunonephelometry. Yan. So, isn't it that your nephelometry is about turbidity? So, based on the measurement of turbidity created by apolipoprotein antibody complexes. So, class ito, here's a summary. Pre-B ang VLDL, before globulin. beta-globulin does not migrate ang chylomicrons. So class, we have this Grindelwald's formula. So it's an indirect method of measuring your LDL at milligrams per DL. So pag nakolekta mo na yung TC, HDL at triglyceride, so ito yung formula. So total cholesterol minus high density lipoprotein minus triglyceride divided by 5. So triglyceride divided by 5 is actually your VL. Yan. So, ayun. So, that's your LDL. Kung paano i-compute yan. Huwag kakalimutan ha. So, yan class. That's it for today. I'll see you again. Bye-bye.